You may not realize this, but early warning signs of dementia and cancers can actually show up years before as skin problems. I'm Dr. Lou, I'm an infectious disease specialist, and in this video, I'm going to show you 5 warning signs on your skin that you shouldn't ignore. So number 1, dry, chapped, flaky skin. That could be a sign of lymphoma. Lymphoma rates are increasing in younger women, and there are lots of different reasons, including toxins and viruses that could cause lymphoma. I had a patient I saw for the first time to fill out just school forms, and she had no complaints, but she told me she's been having dry skin for years and just kind of lived with it. I looked in her throat and one of her tonsils was enlarged. It turned out to be lymphoma. She was actually a college student in her early 20s. This is a danger, not addressing skin conditions, actually looking for the root cause and just using lotions, creams, and steroids. These topical remedies may improve the problem at first, but many find dry skin returns. Some people try antibiotics and antifungals, but they don't help unless the conditions are due to infectious diseases. Allergy testing often return positive, reacting to lots of different foods, including dairy and eggs, and environmental pollens, and as well as things like cats. But despite trying their best to avoid triggers, people give up and just, without realizing it, they just live with dry skin. But that's actually an indication of DNA damage that can lead to mutated DNA, which then cause cancers, including lymphomas. So how do you protect your DNA? Well, of course, avoiding toxins like UV radiation from the sun, nail salons, or tanning beds are super important. Heavy metals, don't do that, or chemicals. But really, there's a second part to good health and good DNA, and that is nutrition, right? The skin contains a lot of immune cells in the layers of the skin, and we have to give it proper micronutrients, essentially to allow the body to heal itself, to calm down that inflammation. So skin problems don't resolve unless you do both. Remove the toxin and give it building blocks. These building blocks need to be eaten. They're not found in your lotions and creams. Number 2, soft, discolored nails. Your nails are not just for nail polish. They are actually a timestamp of your health, like tree rings. So when I see infections, anywhere in the body, I always check the nails because the health of the nails tell me how healthy you've been. And the toenails, it takes 6 months to grow out. Your fingernails take about 3 months to grow out. So I know if your toenails are destroyed from the bottom to top, you've had problems for at least 6 months. Soft nails or ridges in the nails, it tells me you have some vitamin or mineral deficiencies, which could be caused by stress, such as illnesses, medications, such as chemotherapy, or simply poor nutrition. You're not eating healthy foods. Nails that are brown, have brown threads, I should say, are suggestive of trauma or blood clots. And discolored nails with thickened, that powdery look, that's a fungus. That means you have a weakened immune system. You have some kind of circulation problem, chronic blood vessel inflammation. And the majority of people with blood vessel disease, they eat a high-fat processed food diet that causes this chronic high blood pressure, poorly controlled blood sugar, fatty liver, high cholesterol. It's all connected. Number 3, hair loss. And many people think losing your hair is genetic. Sure, there's a genetic component, but hair loss on your legs and feet are actually classic indicators that your immune system is weak and your blood flow is impaired. And if you don't correct the problem, you may get serious complications like heart disease, kidney failure, and abdominal ulcers. You see, many people don't realize your legs and your feet are really the canary in the coal mine. And when your blood vessels are damaged, when your immune system is weakened, that's the first part that you will see any signs of unhealthiness. And this is because it's really the last part of your body to get blood flow or any nourishment, since it's the furthest away from your core body. So of course, the hairs on your legs and feet are susceptible to hormonal changes like thyroid conditions and susceptible to infections like fungal problems, medications, stress. But really, circulation and immunity are key to preserving your hair. So don't ignore it. Lots of people don't even check. They just think it happens because of old age. It's happening because your body is changing. Your immune system and your circulation is getting impaired. Number 4, blisters in your mouth. Blisters and ulcers in your mouth, they are common, but it's not normal. There is something wrong with your immune system when you have recurrent blisters and ulcers. Sure, lots of people are infected with herpes simplex virus type 1. Some estimate 70 to 90% of the population are affected, but you don't see everybody popping up with blisters, right? Only certain people pop up with blisters. And so when that happens, you should ask yourself what's going on with protect my immune system. Many viruses can cause blisters and ulcers, herpes, enteroviruses, Epstein-Barr virus. These, oftentimes, the very first reaction is the most severe. But at the same time, you may be nutrient deficient if you have such a severe reaction or if you're having recurrent episodes. And this is because your skin inside your mouth grows very fast. It's very sensitive. It's one of the thinnest and fastest growing tissue in your body because it undergoes a lot of trauma, right? Every time you eat, you may be cutting yourself, like eating a chip. I had a friend who was eating chips and salsa. He scraped his esophagus, and what happened was he got an abscess in his neck from that. This is why you should chew your food well, but at the same time, that tells you how delicate this mucosa is, and it really lines your entire GI tract. For some people, you could take an antiviral. We only have antivirals to suppress herpes simplex, but it's not curative. Forever, you have that herpes, right? So for 70 to 90% of the population, forever, they have herpes. Why don't they have an outbreak? That's because their immune system is able to keep it at bay. So it's not as simple as, I have a viral infection. It is something wrong with your immune system. And when you have an infection, when you have these outbreaks, those are times of stress, whether you're exercising more, you're mentally more stressed, you're working harder, you're sleeping less, plus you're not giving yourself your equipment to be able to handle that tolerance. That's a huge problem, right? And in times of stress, your body actually needs more micronutrients. Lots of people have the calorie factor, like an 8+ on the getting enough calories. They have pretty much a C, D, and F in getting enough micronutrients. I know a person who, before their engagement, they actually broke out with a cold sore. They were super stressed. Imagine getting married, you're trying to lose weight. So she was on a diet. She basically drank milkshakes, and that's all she would eat. It was poor nutrition, even though she got enough calories. She was missing a ton of micronutrients. And if you just took an antiviral, you would not be addressing the problem, and you would actually open up a whole can of worms to other problems, right? Other DNA damage, because whatever is happening in your mucous membrane is happening in your immune system. They are the fastest growing cells. So this is why you have to address the suboptimal nutrition to reverse the DNA damage and prevent infectious disease outbreaks. Number 5, age spots. My dad had age spots, and he used to put aloe vera to lighten his age spots, and he was so proud that it helped, right? He had seborrheic dermatitis, but unfortunately, those age spots turned out to be a marker of Parkinson's. It is the most common neurodegenerative disorder, right? Seborrheic dermatitis occurs commonly in the face and scalp. It looks like dry or greasy, dry skin. It's like dry or greasy, I should say, flaky skin. You see, the peripheral nervous system is an extension of your central nervous system, your brain, and it's critical to allow healthy skin, right? It allows you not to just touch and feel, but it actually is integral in the health of your skin. So when you damage the peripheral nervous system or the central nervous system, it will show as symptoms in your skin. Nobody quite knows the exact cause of why people get Parkinson's. There are lots of theories. It surrounds mitochondrial dysfunction. And I think many diseases surround mitochondrial dysfunction. The mitochondria is important for you not only to generate energy like ATP, but it helps you to mitigate toxicity. And oxidative stress, along with mitochondrial dysfunction, is a huge, damager to our tissue, our cells. Lots of things like physical stress, mental stress, drugs like statins or antibiotics, or even Tylenol and non-steroidal anti-inflammatories, they actually are known to be DNA damagers and cause mitochondrial dysfunction. At the same time, if you're deficient in certain B vitamins, minerals like magnesium, amino acids like cysteine, they're critical for your mitochondrial health. So if you're not targeting those things in your nutrients, you may be neglecting your mitochondria, even though you're getting enough calories. Keep in mind that your skin is really a window to your health. So don't just rub lotions and oils and do cosmetic surgery. You may look good on the outside, but you'll still be sick on the inside, right? Your body is the greatest healer. It miraculously heals you in so many different ways if you give your body the right tools. So fix your diet. And if you want to know how, that's what the next video is for. See you there.